Hi good people, my name is Caroline Bitha. Welcome back to the GTV and thank you so much for the support and for the love that you have been showing us. Manze nyi watu ni watu. This is the Afya Leo program and today we are privileged to have one of our, niliwaambia si mgeni tena, ashakuwa part of the family of the GTV. So kindly Nasroda, introduce yourself to our viewers.
Thank you. Good morning, viewers. This is GTV, the GTV Live Afya Leo program. Once again, I'm here. My name is Rhoda. I welcome you to Afya Leo. Today, we are going to learn more about
Hypertension.
Hypertension in pregnancy.
That is high blood pressure and high blood pressure general and peer high blood pressure in pregnancy. Okay. Remember, you can be part of our programs by supporting us via our till number, that is 9626895, and you can also keep your comments and questions coming via the number on your screen, that is 0711 352 883 0711 352 883. Let's jump direct to the program. So hypertension. What is hypertension?
Hypertension is a BP, let me say, blood pressure that is above 140 over 90. What I mean is, to say someone has hypertension, beyond other signs, you must use a measure of blood pressure. So it is a blood pressure that is above 140 over 90.
So 140 over 90 is the hiyo ndio ya kawaida, that is the normal.
Okay, that is the normal levels. There is a level of diastolic. That is the let me say the numerator in other language.
Yes.
Then there is a level of systolic. So when the BP is taken, there is usually there is the upper BP and the lower one. So when the upper BP goes beyond 140, or rather reaches 140, and if the lower BP reaches 90, now we can say that person is developing hypertension.
Okay.
Yes.
And how is high blood pressure? How is blood pressure inapimwaje? Ni ile tu njia ya kawaida ile yenye tunawekewangu hapa kwa hospitali?
Ni ile njia ya kawaida. It looks very ordinary, but it is one of the most important things in realizing hypertension cases. So what matters is how it is taken, how regularly, and the accuracy, you know. So, but inaccurate taking of blood pressure and the levels are high or elevated, then we can say there is hypertension.
Okay. Yes. And is there a age limit ya mtu mwenye anaweza pata high blood pressure? Okay,
there is usually we say adults are more prone to high blood pressure or to hypertension than children. You know, the adult age starts at 18, so we say after 18 years.
Okay.
Yeah. And
what are the causes of HBP?
Okay, hypertension, it has no known causes. We say the causes are idiopathic. That is, they are not very well known, but we say they are predisposing factors to high BP or to hypertension. And some of these are like hereditary. That is to mean hypertension can be inherited.
Oh.
Yeah, that is a predisposing factor. That is why you'll go to the hospital, and when the doctor is examining you or taking history, they will ask you, do you have someone in your family who suffered or who suffers from hypertension? That one shows that this disease can be inherited.
Okay.
And also, there are things like gestation. Gestation is pregnancy, like we are talking today about pregnancy and hypertension. So there are women who will develop hypertension due to pregnancy. So that is also a factor. The other one is lifestyle. You know, the lifestyle that we live as Africans is not the same lifestyle like that the white people will live. As it is saying, the whites develop more cases of hypertension than the blacks because of lifestyle. Also, it depends on the age. Age is on another factor also. Like we said in the beginning when we were starting as children, at the lower age are not affected by hypertension than the older ones.
Adults.
And also we say after 50 years, that age is more prone to hypertension. So age is also a factor, and so many others.
Okay, and you talked about age na pregnancy, HBP in pregnancy.
Yes.
What causes HBP in pregnancy?
Hypertension in pregnancy is also not very well known, but we relate with the hormones. These are someone who is developing hypertension when she is pregnant. There could be systemic causes, and there could be also hereditary causes. So when these BPs are taken in pregnancy and they are high, we get down to examinations, investigations, and further management actually. So it can be gestational because of other reasons. And these reasons now have to be found out. So now this is the work of the doctor or the health practitioner who is attending to the woman who is pregnant to go deep and find out the cause. But we cannot clearly say automatically there is a specific cause.
Okay.
Yeah.
And what are the stages? Icona stages of
Yeah, hypertension has stages.
What are the stages?
Yeah, the stages depend on the measurements of the BP. So as I said, any BP that is above 140/90, or that is 140/90 or above that, between that and 150 and 95, that is mild BP. So we have mild BP, we have mild hypertension, we have moderate hypertension, and we have severe hypertension. So any BP that is above 100 is above 140, ranging between 150 to 100. That is 150, 100, 150/100 as it is written. That one we can say it is mild hypertension. But now when it comes to above 150 and above 100, depending on the range, the upper one is above 150, the lower one is above 100. Now we have come to severe hypertension. So we have the three classes, mild, moderate, and severe. And you will notice even in the management, we manage according to the severity or according to the level of hypertension.
Okay.
Yeah.
And it says that people who are suffering from some diseases, they are at a very high risk of contaminated, or rather wako kwa risk kubwa ya kupata HBP. Is that true?
Yes, it is true. It is true that people, especially who are suffering from organ failures, when we say organ failures, it's like kidney failure, liver failure, and other organs, heart failure. So those organ diseases are related to hypertension. And in this case, hypertension may come as a complication of another problem in another organ, or as a complication of another disease. So they can relate with other illnesses.
Okay.
Yeah.
And what are the signs and symptoms?
Signs and symptoms of hypertension. Okay, usually we say the first sign and symptom is the patient will not present with anything. Okay? Maybe this is somebody who was going for a checkup. This is somebody who was just passing somewhere and there is a station where MBPs are being checked. And once they get to be taken the MBPs, they get it is high. So the first, okay, they may not experience signs, but on check, on instant check of a BP, they are diagnosed with hypertension. Then there are other causes, there are other signs and symptoms which will be presented or they will be noticeable. For example, people may come with headache, severe headaches. Others will come with dizziness. There are others who will come with fatigue, general malaise, that is their bodies are just feeling like that. It is called hyper syndrome. Hyper syndrome means there is pain here, there is pain here. Then they cannot specify where the pain is. That is what is called general malaise. Others will come with sleep disturbances. They are not getting enough sleep. Others are not sleeping at all. You know, there are many signs, there are many symptoms. But now all these combined together with BP check.
Okay.
Yeah.
And to pregnant mothers, what are the main causes?
Okay, in pregnant mothers, I said the cause may not be known. It's not specific. But when we realize, actually, when the mother comes to the clinic, there are vital observations that we do. And the first one is checking of the BP. During routine examinations, we may find out that this woman has a high BP and she's pregnant. She has not had any BP or high BP before. There is no history, family history of high BP. Now we realize this is gestational hypertension. So the cause, I said, it depends on what the health practitioner finds out from the investigations. Maybe when we do investigations, we may come up with a cause. We also take this woman through ultrasound, and radiological examinations can also tell us, because during in utero or inside the uterus, where the baby is formed and where the baby habits, we may find out some malformations, some malpresentations, other complications of pregnancy. Maybe they could be the cause, but generally I would say the cause is unknown. But when we get in to investigate or to examine, we may come up with a cause.
And what are the signs and symptoms
in pregnancy?
Women? Yes.
Okay, the first sign, of course, is high BP. Then other women will come with dizziness. Other women will come vomiting. Others will come saying they have fatigue, they have sleepless nights. Others will come saying they cannot even walk. When you look at their lower limbs, you find they are swollen. That is edema. When you also look at their face, they are swollen. It's swollen. So that is what we call facial edema. And the lower one is called ankle edema. Okay, when we try to press the swelling, it kind of digs in. So when you press, unlike the other edemas, you know, somebody can get swollen for other things. But in this case, if you press that swelling, it sinks and it takes time to come back to normal. And then this woman may also come and tell you, I am passing very little urine, you see. And also they may present with signs of urinary tract infections. They may not know it is a sign of high BP, but us as health workers, when we do urine for microscopy, we may find out that there is a problem with the kidney. And I said the kidney is the most affected, or the most organ that suffers complications. So these signs and symptoms vary from time to time, and we will, or at the end of the day, we manage. Yes.
So there is there is no a certain cause of HBP, as you're saying. You can only find out when you examine.
Yeah, mostly during examination.
Okay. Thank you so much for keeping in touch. Keep sending your questions via the number 0711-352-883, and we will be back after the short break.
Thank you.